welcome back to another episode of Questions with Bob and Craig. I'm Dr. Scott,
And I'm Dr. Becker.
also known as Bob and Craig. That's kind of confusing for some of you that were using our last names. A couple updates real quick, and then we'll get into what we're going to talk about today. We're excited to talk about what we're going to talk about today, but first we do have an update on moving into the new office. Right now, we are planning on moving in May the 4th, that week. So right now, everything's on schedule. Construction is what it should be doing. Again, we're doing a lot of this, but we're hoping to move in that week and then start seeing patients like we used to, getting up to that point shortly after that. So we're going to take it slow, getting started. We're going to have a few patients ease into it. Things are going to take longer now because of all of this, but we're going to get our system down, but we're going to start seeing patients back hopefully very soon after that. So be on the lookout for an announcement regarding that. One more thing, we've had some of you submitting some information, some photos to us. We have some videos about that. We have a new way to do that. Instead of texting those to our office, we can actually have you go through our website, getitstraightortho.com, and there's a blue tab in the lower left that mentions submit your photos for virtual treatment. Just click on that. It's got some information, some check boxes. You can write some stuff in there. It's pretty cool. So go through the website, getitstraightortho.com, and you don't have to do the texting method that we talked about. So, back to what we're going to talk about is called dental monitoring. What is dental monitoring? People are wanting to know. Well, I'm going to tell you what dental monitoring is. It's a way for us to monitor your treatment while you're at home or to monitor it remotely. It's a great way that technology has introduced us to this virtual a way for us to look at you. You don't have to come into the office. We're going to get into more details about that, but that's something that we're going to open up, and we're going to start moving into that. We started actually using it in January, and we kind of before all this started, and we're going to start ramping that up a little bit more. So you might be asking, dental monitoring, who is eligible or who can use dental monitoring? I'm going to have Dr. Becker answer
Well,
that.
that's a good question. Anybody can use dental monitoring, and like Dr. Scott said, we've been using dental monitoring with our Invisalign patients since the first of the year. And basically what that means is they're taking a scan on a weekly basis. We're monitoring those scans and making sure their treatment is tracking the way it should. And thus, we can track it that way, and we can decrease the number of appointments that you actually have to come to the office. So if you live out of town, if you're busy, everybody, both parents are working, kids are busy with practices and after school activities in school. So we can decrease the amount of visits you have to actually make to the office and still get that quality of treatment, and we can continue to monitor things for you. If things aren't going well, then we can let you know that too, and then we have to get you back in and get you back on track. So we're also looking at starting to use this with our braces patients. And the same way we'll go with the braces patients is that we're hoping to decrease the stress on you to come into the office for your appointments, and we can monitor things more virtual. And you know, we've been kind of doing this. We've been having patients take pictures and sending us things when there's a concern, and dental monitoring will help take care of that for us.
We're really excited, and we've seen some great results so far. As Dr. Becker talked about, braces patients and Invisalign patients, we can do both of those. As far as, you know, what is it more specifically, we'll get into those details, but for some patients, we'll give you a scan box and retractors to use to put your smartphone in to do the photos. Other patients won't need to use that, so there are different levels depending on what we need for you. We'll be using the dental monitoring for that. Another question you all might be wondering is, what is the cost? What is the cost of dental monitoring to the patient?
So for our patients, there is no additional cost for using dental monitoring. And so there's a cost, of course, to us using it, but as far as what the patients are going to see and the parents, there is no additional cost to that. And also, with dental monitoring, it's a great tool for us and for the patient, but if you're not comfortable with the technology or you don't have a smartphone, you won't be able to use dental monitoring, that's fine. We've been doing orthodontic treatment for years without this, and we would continue to treat you if you don't do dental monitoring in the same way going forward as we've done in the past. So
the one big difference that we've noticed, and when we look deeper into this technology, is we would, you know, for braces patients, we might put a wire in and see you back in 12 weeks. During that 12 weeks, we don't know for sure what's happening during that time. Well, now we have a way to monitor that. If a wire has come out, if a brace has come off, if a door has come open on the braces, we're going to catch all of that during that time instead of just us seeing you here and here, we're seeing you all along the way. So it's really cool technology. And like I said, we're excited. We've been doing it since the beginning of the year, but we're going to start ramping that up. So be on the lookout for information from us. Some of you might be getting some information about the app. We're going to tell you who needs to download it and when to download it and how to get involved with it. That's all coming very soon. So be on the lookout for that. Was there anything else that you wanted to mention?
The other thing that we're going to be monitoring too is oral hygiene. And so when we're not seeing our patients for 3 months at a time or so, we can continue to monitor. So parents, if we notice that your child is missing a spot here or there, we will be notifying you that, hey, we need to step it up, do a little better job brushing this certain area. We're noticing that the plaque buildup is there or the gums are irritated. So that's a great tool too.
That's a good point. If you guys have any questions for us, submit those to us. You can text them to us, you can message us on Facebook, get a hold of us any way you want to, and we will answer some of your questions either through that directly or we might do an episode dedicated to your question. In the meantime, be safe. We hope to see you guys back very, very soon. Again, we're shooting for middle of May. I think that's doable, but we'll keep you posted on that. So, we'll see you next time. Thanks.
Thank you.